Hello everyone. Today we're going to talk about a common type of headache we alluded to in prior videos that we taped together. This type of headache is called chronic daily headache, or sometimes referred to as medication overuse headache, or MOH. We use those terms interchangeably. The chronic daily headache, or CDH, is a type of headache in which patients have headaches several times a month, many times a month, more than 15 times a month, or near daily sometimes, or sometimes daily. And it is generally thought that these patients who are having daily or near daily headache have another subtype of headache underlying the chronic daily headache. It starts with more commonly migraine headaches, and from certain overtake of certain medicines, they can develop into a chronic daily headache. Also, patients can start the chronic daily headache by having a chronic tension type headache. The bottom line is that the person would start with subtype of headache and then will take a lot of medicines, especially over-the-counter medicines or butal containing products, and then that person would develop chronic daily headaches from the intake of these medications. And the commonest medication out there in the United States that can cause chronic daily headache is butal containing products, or commonly referred to as Furoset, but also it can occur with over-the-counter medicines, Excedrin and other agents, and it can occur also with the triptan class of medications, the Imitrex, the Maxalt, the Zomig, just to name a few brand names, but there are many others out there. And patients who have chronic daily headaches have to be evaluated by their neurologist to make sure there's no organic etiology for this frequent headache. Once we rule out anything else, we can then start the process of treating chronic daily headache. Chronic daily headache is common. It can occur up to 1% of the population, so it is something that one has to pay attention to. And there are certain medications that we can use to prevent headaches in those patients, but the most important factor is to actually withdraw the offending agent. In other words, trying to stop or wean off, and sometimes we have to do it slowly, the agent that we think is responsible for inducing chronic daily headache. There are also some behavioral modifications that we have to do in those patients that have chronic daily headaches, because it's thought that some of them have a particular personality type that makes them more prone or more at risk of developing chronic daily headaches. So we have to pay attention to that and maybe do some psychotherapy or refer them to a psychologist to help out with this process. And sometimes this process can be quite lengthy, that they have been on products that cause chronic daily headaches for a period of time, and we cannot simply just stop them suddenly. We tend to notice this in patients, for example, who are on butal containing products like Furoset, because some of the products that are present in that combination medicine are habit forming by themselves, like the butal, for example, component. And we can slowly withdraw the butal medication instead of suddenly stopping it. But the goal would be to eventually get off this medicine altogether, because you will not get better unless the offending agent of chronic daily headache is completed. But if I have to leave you with one thing, is that you have to make sure that you're ruled out for every secondary cause before your neurologist labels you as having chronic daily headaches. So make sure you talk to your neurologist and fill out the diary that's present on our website, and that will help you and your neurologist trying to differentiate whether you have risk factors for chronic daily headaches or not.